It's U of L Today on 93.9 The Phil. Here's your host, Mark Hebert.
And welcome to U of L Today with Mark Hebert on 93.9 The Phil. This is the show about all the good stuff going on at the University of Louisville, all the positive news coming out of the University of Louisville, and all the great work that's being done by the researchers, faculty, staff, and students at U of L. So I hope you'll stick around for the next half hour. Maybe you'll learn something. On the show today, when a child shows up in a hospital with signs of possible abuse, there's a good chance that child's life is in severe danger. And we'll talk to a U of L researcher about that, along with his study of insurance coverage for spinal cord injury patients. But first, he's a University of Louisville alumnus and an employee who has different lungs than the ones he started with, that he was born with. Steve Lindsey is here to talk about his lung transplant and his attempt to climb a tall building with a single bound to raise money for the Lung Association. And with Steve is Dr. Rafael Perez, who's a pulmonologist and a professor of pulmonary medicine in the U of L School of Medicine. Rafael and Steve, welcome to the show. Good to see you.
Thanks for having us.
Thanks for having us.
Glad you're here. Glad you're here in one piece, Steve.
Yes.
So tell us, you've got two lungs, right? Two brand new lungs.
I do. Well, not brand new.
No, well, they're about a couple years old,
couple
but
years.
different than you were born with.
Different than I was born with. Yes, absolutely.
Okay. So how'd you get a lung transplant? When did it happen?
I went into the hospital on May the 7th, 2015, and after 10 hours in the surgical suite, I was rolled out unconscious with new lungs.
Two new lungs.
Two new lungs.
Okay.
And what I had before that was a disease called idiopathic pulmonary fibrosis. Idiopathic means unknown illness. Pulmonary means lungs. Fibrosis means stiffening and hardening. If you want to know what it's like to have pulmonary fibrosis, it's like trying to breathe through this.
And what you're holding up is a coffee stir
stick.
Yeah.
It's a coffee stir stick, and that's what it's like to have pulmonary fibrosis.
Let's try and breathe through that, huh?
Yeah.
Okay.
Now, Dr. Perez can tell you a whole lot more about the medicine of that.
Well, I'm going to ask him about that in a minute here, but I want to get a little more of your background.
Okay.
So, 3 years ago, right?
3 years ago.
3 years ago, you get the new lungs. And did you have the transplant at U of L?
I did.
U of L doctors?
And a professor of thoracic surgery, Dr. Victor Van Berkel, was the one that performed the surgery. He's
we've had him
also
on
the
the program
University
before.
of Louisville.
Okay.
Yeah, he's really tall.
Yes, he is very tall. He's about 6'8".
Mm-hmm.
So he did the surgery. Went well.
Went very well.
Okay.
And I left the hospital 12 days later after the surgery. And honestly, I've never really looked back. This will be, you mentioned the climb, this will be my third climb since having the transplant. And I guess just to add a little mix to it, 5 days earlier, I'll be 60 years old.
Okay, so 60 years old, climbing a building. All right, well, real quick, why don't you tell us about the climb that's coming up and kind of pitch that. We'll talk about it again at the end of the segment and go from there.
Well, my hope, the American Lung Association is of course raising money to try to fight lung disease. In fact, I imagine that Dr. Perez has been the beneficiary of some of that. The Fight for Air Climb is a athletic event, much like a 5K or a half marathon or something like that, except for that we're going up instead of out. And actually, Dr. Perez has done the climb once before, and
he's here to tell about it.
Yeah,
I made it.
And it is certainly not as daunting as it sounds. We will be starting on February 3rd at 9 o'clock in the morning, and I imagine everybody will be to the top within a half hour.
How many steps is it? How many floors?
768 steps, 38 floors.
Of the National City Tower?
Of the National City Tower.
that's just a long ways, man.
Now,
so the man with two different lungs is going to make that climb for the third time, you said? Fourth time?
The third time.
Third time? Okay.
Now, last year, the winner finished in 3 minutes and 58 seconds.
That's just crazy. Sorry, that's just crazy. All right, well, we'll talk about that fundraiser here in a little bit more in a minute. That's Steve Lindsey, who's got two new lungs, as you heard, and you're also a university employee, right?
Yes.
Where do you work?
I work for information technology. I will be celebrating my 35th year with the university on July 1st.
All right, very good. All right, Dr. Rafael Perez, good to see you.
Good morning.
Tell us a little bit about what Steve had and what all these other people have, what the problems with their lungs. What is it?
Sure. So Steve mentioned that he has this condition called idiopathic pulmonary fibrosis, and it's probably the most common of the fibrotic lung diseases that we see in Steve's age group. But there are many different reasons or ways that the lungs can become fibrosed. It could be certain medications, certain industrial exposures, certain types of diseases that affect the lungs and scar them. But the common denominator here is the fibrosis, which really means scar. So think about it. You know, when you injure yourself, you develop a scar to kind of close the injury, but that scar is not really functional. It's not skin. It's not intended to do what the organ initially did, and that's what happens in the lungs. They get scarred, they don't function like they should. They get stiff, they get heavy, they get very elastic, and it takes a lot of work to expand those lungs to get that breath. So it's not so much, I mean, the oxygen levels can go down in these individuals, but it's really the stiffness of the lungs that cause the problems that these individuals get, and over time, as the lungs progressively get worse and worse and stiffer, as they do with idiopathic pulmonary fibrosis, we got to do something. And by far and away, lung transplantation is the most common way to deal with it in individuals who do qualify for lung transplant. It's not an easy thing to have. About a third of the lung transplants we do in this country are for idiopathic pulmonary fibrosis. In 2014, the first 2 drugs that came out that were FDA approved to treat pulmonary fibrosis came out, but they're still kind of iffy. They seem to slow down the disease a little bit, but they are not the end of the story. And we're still doing a lot of research. We're doing clinical trials here at UofL to look at idiopathic pulmonary fibrosis and new therapies.
Yeah, that's what I was going to ask. Are there drugs that people are taking now, or Steve, did you take some drugs before you had the transplant to try and help this condition?
I did. I took a drug that goes by the commercial name Hebert. But this drug, it does not stop the fibrosis. It does not reverse the fibrosis. It merely slows it down. Is all it does.
Gotcha.
And not without side effects.
Okay.
Right.
So, Dr. Perez, you said about a third of the folks that...
Lung transplants in this country are done for this condition that Steve has. Yes.
All right. And how many are done at UofL and in Louisville per year?
We're doing about 2 lung transplants per month. That's
Okay.
about average nationally. There are some centers that do many, many more, like Duke, for example, Cleveland Clinic. But we're kind of in the average pool there, about 2 a month.
And the success rate, obviously Steve's a success story
Right,
here, but what's
right.
the success rate for a lung
It's
transplant?
tough. We have to worry about rejection. We have to worry about infection. So 80% of folks in the first year will probably do okay with a lung transplant. We have, so that means 20% of people will not do well and will not survive the transplant. At about 5 years, it's 50-50. There's some issues with what we call chronic rejection that we're working very hard to try to overcome across the world. And to hopefully increase the numbers of people who stay alive for longer periods of time. So we have to look at that window, that sweet spot. When do we give someone like Steve a lung transplant? And boy, did he need it when his time came. And he was in otherwise great health, and you can see that he's a result of a really good success with lung transplant. And we hope to keep him there.
We're talking with Steve Lindsey, who's a lung transplant what do you call it? Recipient. Recipient's the word I'm looking for. And Dr. Rafael Perez, who's a professor of pulmonary medicine in the UofL School of Medicine. So, Steve, when you had this 4 or 5 years ago and your condition was worsening, what was it like on a daily basis? What could you do and not do?
Coming to work became a real challenge. My wife and my daughter had to load sometimes as many as 5 oxygen tanks into the car for me to get to work.
Wow.
And I was thinking about this as I walked over here from across the campus. Had I tried to done this before the transplant, it would have taken an entire bottle of oxygen, and by the time I got here, I would be so out of breath I wouldn't be able to talk.
Wow.
It was horrible.
So you were struggling.
Yeah.
So you're one of those guys that's carrying around the oxygen tank with you on the little cart, right? That was you.
That was me.
4 or 5 years ago.
Yeah.
But you're not doing it now.
Not now.
And you don't have to drag it up the steps when you do the fundraiser here in a couple of weeks, right? Yeah. All right. And doctor, what's the prognosis for a patient like Steve? It appears he's gone 3 years.
Right.
He's got 2 new lungs. Appears to be healthy to me. What's his prognosis?
After the transplant or before?
After the transplant.
After the transplant,
we know
Steve
before
has
it's
done
not
wonderfully
good, right?
well, and it varies from person to person. I have patients who I've been seeing for 10, 20 years following a lung transplant and who continue to do well. A lot of it is the luck of the draw. We try to match folks as best as we can, looking at blood type, looking at size, looking at other parameters to hopefully make sure that they accept the transplant as best as they can. And Steve just drew a really long straw, and we're happy that he did. And we have a lot of folks who similarly have done well, but we do have cases and some tragedies that we have to live through as well, along with the families of these folks who get lung transplants. They don't work all the time.
Right.
I think we should not forget that you are taking a regimen of medications to prevent the rejection.
Anti-rejection drugs.
Right.
And they are not without side effects.
Right.
And
so do you have some that
yeah.
that you're suffering with?
Yeah, I don't know that I really want to talk about it on the
Oh,
radio.
okay.
but-
All right. Well, I won't, then we won't have to talk about it on the radio. But everybody should know it's
Yeah.
not a piece of cake.
No, it is
Right.
not a piece of cake.
It's not a piece of cake. All right. What's the and how long is the list of folks who are on the lung transplant donor
Right.
list?
Well, the lists are going to vary, and it varies from region to region. And there's a complex system that when an organ becomes available, it goes to the nearest individual. For example, there's also something called the lung acuity score, depending on how sick one is. So if your number is really low, you might be near the back of the line. But say you get worse suddenly, then you start moving up to the front of the lines. But the bottom line is this: in this country, it takes on average about 3 months to get a lung transplant once you are listed.
That's not bad.
So that's not bad. It used to be worse. So now we have a much better system to get the lungs.
Yeah.
I waited 14 months.
Okay. So you were beyond the normal wait period.
And just a statistic.
Were you worried you were going to die?
I became worried, yeah, very much so. Just a statistic to throw out there, at Jewish Hospital, the average survival is 6.3 years from
Okay.
a lung transplant.
Okay. And you live 3 and change so far, right?
Yep.
So you got at least another 3, right?
least
to
another
hit
3.
the
Well,